This is an E-Impulse miniseries, Push Dose Pearls, with your hosts, Sarah Medeiros and Julia Magaña.
Welcome back to an episode of Push Dose Pearls, our ongoing series of brief podcasts that address questions we all have regarding medications in the emergency department. We are here with Chris Adams, our ED Clinical Pharmacist at UC Davis, and our own E-Impulse Pharmacist. Today we're going to talk about Naloxone programs in the emergency department. Welcome, Chris.
This is one of my favorite topics.
All right, let's dive in. So first off, what is an ED-based naloxone program?
So this is the idea that we are providing these simple-to-use naloxone kits to the general public. That may be just patients alone. It could be family members of patients. It could be our providers and staff. But it just is the availability of free naloxone to be provided to the public.
Wait, I can get it?
Maybe.
Oh.
It's coming. I hope.
Okay, why is this one of your favorite topics, Chris? Why is this important?
This stands to be an opportunity to save lives. And we all know that naloxone is this miracle drug in situations where we have an opiate overdose and a bystander happens to have naloxone available, and it potentially saves someone's life. And that's really special, something that we all should have the ability to provide.
So I love that we have this option in our ED. How would somebody go about getting this started at their shop?
So this is very dependent on where you're practicing. Each state has individual programs that may or may not be available. So it's really hard to describe exactly how an individual can take this or make this happen. Most states do have some funding available, and there are grants that can be applied for, but normally at the state level for funding to be available for this. I can only speak to California, as that's our practice environment, but there is an ongoing process for funding naloxone distribution within the entire state of California. So this is taxpayer-funded naloxone that's available free of charge for individuals.
Yeah, it's pretty incredible. I was actually in a meeting the other day, and one of my friends was holding up his box. All of the residents of that state had been sent a box of naloxone. And he's like, look, here's my box. And it's like, wow. It's pretty crazy.
With California, they require a standing order from for whatever site is dispensing the naloxone. In a lot of cases, they want an application. And then once you apply, and it's a relatively simple process, then they will send you free of charge, no shipping, no nothing, a certain quantity of naloxone. This system was originally set up for churches, community centers, police departments, firehouses, areas where no trained medical professional would be available so that naloxone could just be readily available to individuals. And it's since expanded into emergency departments, pharmacies. And so these medications really are readily available in a lot of areas.
So what patients do you suggest that we send home from the emergency department naloxone?
Everyone, no. The reality is this program was initially set up for high-risk individuals. So a situation where you may have someone who is coming in for an overdose. Obviously, that's an excellent person to provide naloxone to them or their family. A situation where a patient is coming in that self-identifies a history of or ongoing substance use disorder, it's an excellent option to provide a naloxone to that patient. Individuals that were recently incarcerated and released, in those situations, I think that's a great option to provide naloxone. Where we are providing large quantities of opiate prescriptions for patients with real pain needs. In those situations, I think naloxone is an excellent choice just to have on hand. But in general, most patients are going to have a friend, a family member, a loved one, an acquaintance that has some kind of substance use disorder or real pain needs that's on large doses of opiates. And so generally speaking, most patients are going to have a potential need for this. And so I think a lot of patients could benefit from at least just having this in their possession.
What about kids?
With children, obviously, thankfully, we have a far lower volume of patients that are experiencing opiate overdoses. However, they still do happen, and unfortunately, they happen with some regularity. And so I think providing naloxone both to adults that are around children and in some cases adolescents might be a good option. The challenge is that the device that administers this intranasal naloxone is not so simple that even a child can use it. It is extremely simple, but I mean, it depends on what age we're talking about. In a lot of cases, they probably could get away with utilizing it, but do they know when and how and where to use the medication? That's challenging. By and large, this is a very, very simple device to use, so most children could utilize it. But when you start getting into 3, 4, 5, 6 years of age, it's hard to know if that child would be able to appropriately utilize it, and then the next steps after utilizing it. So it's kind of a tricky area, but if there is an adolescent that is suffering from substance use disorder or is around substance use disorder, providing naloxone to that individual might be a good idea.
I think when I think about it for kids more in the context of should we send it home with kids who were prescribing opiates for the parents to be able to utilize?
Sure. I think that's an excellent option. I mean, we all know that pediatrics are at significant risk of being oversedated with these opiates, but they also have very real pain needs. And certainly sending a kit of naloxone home with the parents is a great idea.
Yeah, or even just having the opiates in the house and the kid having an accidental ingestion, right? A small kid.
Absolutely.
Now, are there any downsides? I mean, other than inducing withdrawal symptoms, is there any danger to naloxone?
Certainly, and especially in scenarios where you've got a patient who is chronic utilizer of opiates, you certainly could precipitate a severe withdrawal syndrome. However, what's worse, the withdrawal syndrome or certain death? I mean, I think it's clear that providing naloxone to any patient in general, even if you precipitate withdrawal, is better than the alternative. A situation could arise where naloxone was used inappropriately, in a situation where someone misunderstood the directions and provided naloxone to someone who really didn't need it at the time. And so in those cases, it's possible that we could precipitate a withdrawal when there wasn't a clear danger to the patient. But I think that the kits are so simple and they have very simple directions right on the outside of the box that it's hard to imagine that happening with any kind of regularity.
What do you tell patients when you give them the box?
Generally, we provide the box and tell them that this is for emergencies, that this naloxone is a direct reversal for an opiate. And so for any patient that is experiencing difficulty breathing, who is unconscious, who may be suffering from an opiate overdose or misadventure, in those situations, naloxone should be administered directly into the nose. And so then I open up the box and show them the directions and tell them that how easy it is and walk them through the actual simple process of administration, but making it very clear that it's not for it's not a joke and that it could potentially hurt a patient, but it can be used for those emergency situations where someone is unconscious. I think that's the key, is the unconscious patient that may be suffering from an opiate overdose.
Chris, what do you see as the next phase in naloxone distributions?
So I heard this just yesterday, the idea of a naloxone vending machine. I love this. So we could put these in public spaces. We're already funding this program at the state level. And so these vending machines already exist for, snacks and candy and food. So we could easily repurpose something like a vending machine to provide naloxone. And again, the directions on the outside of the box are so simple that it really doesn't require a pharmacist or a medical professional to provide any kind of information or directions. So like putting these in like public spaces or a subway station or public transit in an airport or a bathroom, similar to like a condom machine that are in bathrooms these days, I feel like a vending machine for naloxone is an excellent idea to really get it out there in the community easier and faster.
Or maybe like naloxone wherever there's an AED.
Oh, I love it. That's a great idea. The challenge is that they expire, right?
Yeah.
But so do AEDs, right? AEDs need some kind of maintenance over a period of time, but you've only got like 2 or 3 years on these naloxone boxes.
What about where can people get it now if they're a citizen that wants to help, or if they're worried about it inside of their own home, other than being prescribed one in the emergency department?
So for individuals that are looking to just get a box of naloxone, they can certainly ask any of their medical professional providers to provide them a prescription that will be sent to their pharmacy. All pharmacies can have this and have it generally available. Now, it's questionable whether it will be through the state-funded program. It may not be. Most insurances are covering naloxone. So if you are a public member who wants to get involved and just have it available, a simple prescription to a pharmacy is a great first step. Identifying a place that carries this free naloxone can be a little challenging because they may have an active stock or they may have run out. So checking with their local community center, church, police station, firehouse, those places generally do carry these. And if they don't carry them, there is a very simple application process available online where they can apply for a supply of naloxone.
Why do we need a prescription if they're considering using a vending machine to hand this out? Like, this feels like a big disconnect to me.
It's a great question. And I imagine that may be a future direction for us is moving away from this being a prescription-only medication. However, that obviously requires quite a bit of legislative work. And I'm not sure that we're quite there yet. I think there's probably similar to like needle sharing programs or safe use environments. I think that there is some concern of parts of the public for this wide distribution of naloxone. So there still is some social challenges associated with the use of naloxone that we're still kind of working through. But I think that that's a great direction that a lot of lawmakers certainly could be moving in terms of taking away the prescriptive need to get naloxone available.
Yeah, these are all such important steps. And thank you for all of your work on this and for getting this going in RED as well. Thanks so much.